Good evening and good to have you with us on the 9 p.m. edition of the Urban Debate. Just 4 days to go for the phase 1 of the vaccination drive to begin in our country now. Honestly, in a way, psychologically speaking, symbolically speaking, it's going to be a big day, historic day when the vaccination drive begins on day 1. The first set of people are, our healthcare workers will begin to get the first dose of vaccine, the first shot. And then it's going to be a long drawn process, which will at least go on for a year, if not more. Many of us still have basic queries about how it's going to take place. Where am I supposed to get a vaccine? When will my turn come actually is the most important one on all of our minds. If you're not a healthcare worker, if you're not a frontline worker in any of our forces, if you're not somebody above the age of 50, then you're definitely wondering when will your turn come? Should you even take the vaccine? Which vaccine should you take? Should it be Covaxine or Covishield, or should you wait for another one? What if you've already got COVID? Do you need to take the vaccine because now you've already fought back? Your body has the antibodies. Should you still be getting the vaccine? What's the process around it? Do you really need to register on CoWIN and give all of your data? What data do you need to give in? How will the tracking take place? What if you get one vaccine in the first round and the other kind in the second round? How will we ensure this kind of confusion doesn't happen? Will you have to travel or will somebody come to your place? Will it be in your city, in your town, in your village? Or will you have to travel far, far away? Some of the questions, there are many, many more. Last week, we held 2 special conversations where we had our experts come in and take your queries. And we thought, with the response that we got and the kind of queries that we got and the number of phone calls and tweets that we got, that people still have a lot of doubts. Many still believe that overnight, after January 16th, lives are going to change. Many still are already contemplating whether I should get a vaccine or shouldn't get a vaccine, even though their turn isn't going to come for months together. So we decided to bring back our experts and open up our phone lines and have a conversation with you and our experts. If you have specific queries, if you have doubts, if you are hesitant, if there are any misgivings or some news that you've heard that you don't believe, ask us and we will help you prepare better. This vaccination drive is our best bet, along with, of course, the precautions we've been taking so far. But this is the best bet for the world, and the entire world has to do this for us to beat COVID. Now, in phase 1, remember, in phase 1, it's only going to be the 3 crore workers, frontline workers, healthcare professionals that the government has identified. Those who need it the most because they're exposed to the virus the longest all day long, or their jobs are so important out there in the field that they should be the first ones to get the vaccine. For this, the government has decided to procure about 1.1 crore doses of Covishield and another 55 lakh doses of Covaxine. Now, this is just phase 1, just for the initial days. If you're going to actually vaccinate 3 crore people in the next few months, the government needs 6 crore doses. 2 doses, 28 days apart. And after that, 14 days later, the efficacy will actually kick in. So the lines are open. Pick up the phone line and bring us your queries, and we will try and answer as many as we can. Let me say good evening to the panelists that we have. Always a pleasure to have them on our show. Dr. Raman Ganga Khedkar, former head of the Epidemiology and Communicable Diseases of ICMR, joining us this evening. Dr. Sanjay Pujari, Director of Institute of Infectious Diseases in Pune, member of the National COVID Taskforce. Dr. Seyed Hasnain, Professor of Biological Sciences at the Indian Institute of Technology, Delhi, and the Vice Chancellor of Jamia, Hamdard. And Mr. G.V.R. Prasada Rao, former Union Health Secretary with the government of our country. Mr. Rao, let me actually start off with you. In terms of explaining to our viewers what a massive exercise this is going to be. It's not something that we do for a day or two in few of our big cities. It has to reach every corner of our country. Is our government equipped to do so?
Yes, it is going to be not only massive, but something which is unprecedented in the history of this country. We had vaccinations earlier, but they are mostly for children and mothers. But for the first time, we are attempting a vaccination drive which includes all the Indians, practically everyone in the country. So it is unprecedented that way. And the way government is moving forward and also doing it by stages. It is not that all the people are going to get vaccinated in one day. There are certain identified sections of population, like the priority groups, who are going to be vaccinated one after another. So it is a graded type of activity that will go on. I feel that government has understood the gravity of the situation, understood the enormity of the challenge, and I think they are moving in the right direction.
Yes, the enormity of the challenge cannot be undermined because unlike what Mr. Rao was pointing out, unlike just children or even women, pregnant women or mothers, this time it's all adults and all kinds of adults who will also be given this vaccine, which is what is making it more challenging, and the fact that it's literally a race against time. We want to get as many people vaccinated as soon as possible. So let me start off with one query, Mr. Ganga Khedkar, that many people have asked me, and actually there is still lack of clarity on it. Do we get to choose our vaccine? Do we get to choose it if we are part of the government project, or maybe once later it's in the market, then we can?
Yeah, choice is a luxury which we must understand. Now, if you want to make choices, you must have different vaccines that are available and in adequate dosages so that you can choose. But currently, the entire world's population wants to receive the vaccine, which comes to about 750 crore population. And then you have to have a two-dose vaccine. So essentially, it would mean that given the limited capacity to produce this vaccine, though we are the largest manufacturer, Government of India's efforts to ensure that we almost go closer to developed countries and try to provide the vaccine as soon as possible, still we should not expect that there will be a choice of vaccine because it would essentially depend on the supplies that tend to come. But over a period of time, like we know that there are 4 different phase 3 vaccine trials that are going on, and there could be additional vaccines that may also come in India because we are a manufacturing hub for vaccines. You will find that some of them will get approval, and when those approvals are provided, perhaps if they are in adequate quantity that the manufacturer can produce, there could be a choice which we can exercise. But currently, there is no choice. Choice is only on one issue, whether to take a vaccine or still remain vulnerable to COVID-19.
Okay, the other aspect which many have a doubt, and of course world over this debate has always happened, I'm now seeing this debate take place in our country as well, whether we need to take the vaccine or not. Dr. Sanjay Pujari, is it safe to take this vaccine because it's only been tested for such a short span of time?
Yeah, so the important issue that we need to understand is even if the COVID vaccine have been researched in a short span of time, the platforms that have been used for developing this vaccine, like say the inactivated platform, which is the Bharat Biotech platform, or the adenovirus vector platform, have been developed over a long period of time, and safety has been assessed for inactivated platform, say for influenza vaccine. So safety perhaps is not really an issue with these platforms. And we need to really weigh the risk-benefit ratio as far as taking the vaccine or not is concerned. I would certainly feel that the risk of acquiring COVID-19 and the uncertainty of whether I will develop severe disease because of that or not, versus taking a vaccine and making sure that I'm protected, either 70, 80% or whatever, is definitely in favor of benefit for me, particularly vulnerable people, as the government has rightly prioritized healthcare workers, frontline workers, age more than 50 years, age less than 50 years with comorbidities. These are the individuals who may develop severe illness secondary to COVID-19 or have a higher risk of acquisition of the virus. So essentially, the risk-benefit ratio weighs towards benefit, and there should not be any hesitancy to take a vaccine. Remember, getting COVID-19 is not only an individual hazard, but also you are capable of transmitting it to your close family and friends. And that is something which I don't think anybody would really like.
In fact, just to add to what you said, the point that you raised about when you weigh it against the harmful effects of getting COVID, not just to you but people around you, and the other kind of impacts and complications that it may lead to. Dr. Ganga Khetkar, there have been, smaller reports of various other complications, damages to your other organs that COVID seems to have left behind in many people. Now, while these are smaller reports and we need extensive research, is there merit to highlighting that as well? Because often people say, cold ho gaya, fever ho gaya, theek ho jayega. Why take a vaccine for that?
See, one must remember that when we go and compare, perhaps what we do is we try to look at what information comes to us. But not all information that we get as to what happens post-COVID is very well documented and is known. No, some of the side effects some of the post-COVID complications that we are seeing tend to surprise you, because this is a multi-organ disease and almost every organ is getting infected and they produce different kinds of manifestation. Just imagine yourself having a fatigue for a period that could be lasting longer than 4 months' time. Is it not going to affect our productivity? Just imagine that maybe I was having some genetic characteristics because of which I might have diabetes and at a later age, but then just because of COVID-19 it unmasks my diabetes. You find that those people who already have pre-existent cardiac diseases, they tend to develop different complications in post-COVID syndrome. Now, if that is the case, we need to not only talk about it a lot, even if we have little information which we can provide to people, whatever information is there, we need to inform them. You find majority of the people today, those who come for seeking care after COVID, they tend to have a small manifestation for others' eyes. No, that is insomnia. But just imagine for 2-3 months if they are unable to sleep, is that a good risk that we should entail? Even if it occurs in, let's say, 20% of the people, we need to worry about it. I think people need to know about it so that they can make a clear choice between taking vaccine and not taking vaccine and trying to see whether the vulnerability to acquire infection continues to exist when the COVID fatigue for COVID appropriate behaviors is setting in.
Yes, COVID fatigue, I think, set in many parts of our country a long time ago. It's a miracle we managed to, show this much discipline for so long. But I mean, it's really for how long will people follow these norms? We keep saying that even after the vaccine drive begins, and even if you get the first shot, you still have to wear your mask. You still have to maintain your distance. These are things that you will have to remember. Dr. Hasnain, would you like to add to the point that to the question that I asked Dr. Ganga Khetkar? It's not, many people have spoken about feeling fatigue after they've got COVID. Many people have spoken about having digestion issues, lung issues, and far more serious impacts. Not all documented, but is it really worth the risk?
Thank you for inviting me to this show. It was wonderful to meet with such great panelists. I must tell you, from whatever little we know today about what this virus is all about, this is by far the most intelligent pathogen humanity has ever seen. Unlike there's no other pathogen today that can theoretically infect every single cell of the human body. The reason is very simple. It has very smartly added to its repertoire the receptors that enable a cell to allow important players to enter the cell, harmless players. So it has adopted those receptors. And by token, it can actually enter any cell. And that's the reason why, as Dr. Ganga Khetkar rightly said, initially we thought COVID means the word SARS was coined because of severe acute respiratory stress. Now we know that respiratory stress is only about 30% of the cases. The remaining 70% of the cases are non-respiratory related infections. They could be respiratory as well, but primarily, as he rightly pointed out, it could be cardiovascular, it could be diabetic, it could be neurological, it could be anything. In fact, there's the recent case that came to my hospital in Jamia Hamdard, where a small child, presented himself as a case of acute appendicitis. It turned out to be that he may not have been a case of appendicitis. It was purely a case of COVID. And he was treated for COVID. Initially, the doctors were thinking we need to operate upon him. But COVID treatment, an aggressive COVID treatment, took care of his appendicitis. That was the first case ever reported anywhere of COVID even causing something like appendicitis. Unheard of. And now we know that it causes, and the reason is very simple. The receptor that allows the cell or protects the cell from entry of any invading particles, pathogens, viruses, or anything else, that is the receptor that this virus has acquired to enter the cell. So I'm not surprised. This virus is really, in my opinion, this is the smartest pathogen humanity has ever seen. And no wonder it has really united the world like never before. Our typical Indian parampara of Vasudev Kudumbakam, the world is a family, literally.
Yes, yes. The one thing that seems to have brought all of us together is this one virus where, like you said, is also constantly evolving and adapting to survive.
I'll say things about evolution of the virus. It's a very, very alarming thing that's happening around. We need to worry about it.
Absolutely. Well, like I said, I promised our viewers that if they have queries, we have the right experts to answer those queries. So I'm going to just quickly go across to a couple of our viewers. Shri Guru Prasad is on the phone line calling us from Bengaluru. Good evening. Go ahead, please.
Good evening.
Yes,
Hello?
Mr. Guru Prasad, if you can just mute your TV and ask us your query, we'll be able to hear you better.
Okay. Yeah. Hello.
Yes, go ahead.
Good evening.
Good evening. What would you like to ask?
See, I'm a senior citizen and I have a perfect health. I'm a perfect health, like no BP, no sugar, nothing, everything is fine. And I'm maintaining all the protocols of social distancing and wearing mask and everything. But I am little hesitant to wear a mask. To take the vaccine.
Right.
Because like all our earlier pandemics, all the vaccines have undergone a minimum test period of 7 years. This is developed in 7 months. So I don't know, I'm very apprehensive to take the vaccine. Can I abstain from taking the vaccine?
Okay, Mr. Guru Prasad, let me just point out that you said you're a senior citizen and you're extremely healthy. I just want to say there are lots of youngsters in my newsroom who are going to be very envious of you, but I'm glad that you've managed to, keep such good health. To your specific question of can you stay away from or avoid taking the vaccination shot, Dr. Hasnain?
Yes, I would strongly urge that you stay away from the vaccine for the simple reason, if you have no other comorbidities and you are maintaining safe distance, the mask is really scientifically proven that it will reduce the chance of your not only infection, but it will also, if at all you get infected, the viral load that will go into your body will be so less that most likely the immune system will take care. So my suggestion to you is stay away from the vaccine till you don't have to worry about it.
Okay, thank you so much for that. Let me ask Amit Saxena, who's on the phone line from Delhi. Good evening, Mr. Saxena. What's your query?
Good evening, ma'am, and good evening to all your panelists. Ma'am, I'm a 47-year-old diabetic, and I'm anxiously waiting for this vaccine. Ma'am, actually, what has happened is that I'd like to thank Modi ji and all other people who have done a wonderful job and taken on this vaccine in a span of only 7 months. Ma'am, I'd like to ask you that the first phase has already been decided. In the first phase, the vaccine will be given to basically medicos, the paramedicos, and people who have been fighting, and the entire nation is proud of it. Ma'am, what about the rest of the people?
Okay.
Let's say we are talking about only 3 crores of people, and let's say if you have only 800 centers, we are inoculating 100 guys on daily basis. So you say 80,000 people daily. 3 crores means more than in a year. For inoculating so many people. Ma'am, we are 135 crores. So, ma'am, we need this vaccine. I'm into sales and marketing. I'm into one-to-one job. I meet at least 10 guys daily. So, you can very well understand there are so many people who need it urgently. My doctor tells me that I need this vaccine. Otherwise, I'm very pro. So,
Correct. You
what
have
is
a
the role?
valid concern there, especially like
Can
you
I
said,
answer
you
this
are
question?
diabetic as well. Let me just though say, Mr. Saxena, the plan for beyond these 3 crore is still being finalized. The government, in fact, is yet to even define the comorbidities, the order of priority for people who have other conditions, and in which order will they get, and how many of them. And then at some point, once we have enough of this talk, one assumes they will open up and
May
put
I
it in
clarify
the
a bit?
open market.
May-
Yes, Mr. Rao, go ahead, please.
Yeah. I think this concern is genuine, but there is a plan with the government that after these 3 crores are over, then the next lot will be another 27 crores.
Yes.
These 27 crores consists of 26 crores or 25 crores who are above 50 years of age, and about 1.5 crores more who have the comorbidities but who are below 50. So these numbers are already being computed. So the idea is at least within the next 7-8 months, at least by next September, October, I think this entire population of these 25 to 30 crores have to be covered. But I don't say that with the assurance that they will be, but that is the plan. There will be definitely logistic challenges, there will be operational issues, but these are the people who are on the list. And our friend, definitely being a diabetic, even though you are less than 50, you are a part of the priority group and you can look forward to take this vaccine. One more thing I would like to add. In course of the next few months, some more vaccines are going to come, and even the vaccines which are outside the country, they may be getting permission to come into the country. And at some point of time, government has to open the private channel also for people who have to go and take the vaccine. For example, there are people who want to travel. There are students who want to pursue education outside. They may not come in any of your priority groups. Then do you mean to say they have to wait? They can definitely, they have to get an opportunity to go, pay for it, and get a vaccine in a private lab or a private institution. So that facility at some point of time has to come. Otherwise, there will be total clogging of the entire machinery.
Fair enough. You're right there, Mr. Rao. But here is the question then. At what point do you open it up and put it in the open market for anybody who can afford to buy it and get it? Should it be after these 30 crore or, even before that?
Even before. There's no need to wait for these 30 crores to be over. The moment the vaccine production goes up, the moment other vaccines also come into the field, the moment there is enough supply, then definitely government can open it.
Okay. In fact, Dr. Ganga Khedkar, if you would like to come in on this as well, would we need a bare minimum amount of, million doses ready, available with us before we say, okay, now let's put it in the open market?
Yeah, the government's first commitment that they have made to 30 crore people, the government will try to make the best possible effort. First 3,000 crore people who are to be vaccinated, their vaccines will be obtained. And then, as the government said, we would look forward to developing a plan to ensure that we provide vaccines to 27 crore people. And as Mr. Prasad Rao also alluded to, that we will have to take that call of providing vaccines even to private sector or purchasing those vaccines, but it is a function of number of dosages that are available and the manufacturer getting approval in India, which will happen over a period of time. I don't see that door will ever be closed for us, since we have a different kind of public health system that tends to operate, which is not only dependent on public sector but also on private sector as much. The second issue which I would like to bring in, I'm sure when Dr. Hasnain did answer the first question, the answer was given very clearly that you need to continue to wear mask.
Yes.
But there is one issue which I would always try to discuss more, and that is, even if you wear the mask well, one must remember that you could continue to be at risk of acquiring infection, because it's not essentially only in your hand. This is a droplet infection, and since it's a droplet infection, the risk does not end to as high as 100% reduction in the risk, but it will also depend on somebody who comes to your house, somebody who is an earning member who is going out, and he brings in that infection and leaves those droplets for you to touch, and you touch your mouth or ear, and then probably have it. So I would say that not taking a vaccine could be a risk that you have to think about. The uncertainty will continue to loom if you don't take the vaccine. Since you are belonging to a high risk group, it would always be worthwhile to consider taking vaccine rather than not taking.
I agree. I agree with Dr. Ganga Kedkar, because in your own family, there could be a child who goes to school and the child may get infected. There will be no manifestation. He'll be absolutely healthy, but the child will be passing on the infection to the others in the family, and the grandfather may get it. So, in fact, I know a personal case in my own family where the infections came through a child who has gone to a daycare center. So let us not be complacent about it. I think it's better that people go for the vaccination unless there are compelling reasons to stay out of it. I don't think there are any. The only reason I can see is non-availability, and that is not going to be a factor in our country. They are going to be made available, so it's better. And then about this fear of other reactions, etc. The only reaction I have seen, at least till now, I have many friends who have already taken in US. The only reaction is a little bit of chills one day, a little bit of fever. Maybe it will stay for a couple of days and it goes. And that happens in many of your vaccination programs. Even a flu vaccine, if you take, you will get a fever for a day.
Correct.
So there's nothing great about it. I mean, let's not create unnecessary fears that this is something new that has come. It may cause damage to you. In fact, the damage will be caused more by the virus than by the vaccine.
Okay. In fact, Dr. Pujari, even if somebody is healthy, but beyond, a senior citizen, beyond a certain age, would it be risky to assume that, I will not have any complications, so I don't need the vaccine?
No, absolutely not. The data is very clear that age is an independent risk factor for severe disease with or without comorbidities. In fact, the relationship of mortality with age is linear. As your decades increase, the risk increases manyfold. So just being elderly is also a risk with or without comorbidities and should be taken seriously. And I would agree with Dr. Ganga Kedkar and Mr. Rao that we need to be very keen to, make a choice to take a vaccine.
Okay, Dr. Hasnain, would you want to comment?
I just would like to clarify one thing.
Yeah.
We must learn from what's happening in countries which have gone in a big way in vaccination, and also look at what the country like India, the kind of challenges that we have. Let me tell you very specifically, in a country like UK, what they have done, they have really big logistic problems despite being a much smaller country and more vaccine, more system to deliver vaccine. Yet they are not able to follow the vaccine regime. Why is it so? Because they want to make sure that everybody first gets the vaccine, then we first dose, then we give them the second dose. Now come back to a country like India. A country like India, where we still don't have enough dose. Imagine countries like UK and Canada, they have already got many times more than the requirement, yet they have this problem. So what will happen to a country like India? I think Modi ji has done a very nice thing by saying that let us vaccinate those who are healthcare givers, so that tomorrow, if we have a situation like they have in the UK, where or in California, when 10% of the population is infected now and it requires hospitalization, what will happen to a country like India? So I think we are only looking at timing it. I'm not saying they don't need to take vaccines at all.
Okay.
I'm talking about tomorrow. Do you need to take it tomorrow? That is what I'm suggesting.
Okay, fair enough. A point that you've made there, that, how many vaccines will be right away available, and whether you want to be part of the rush or you can wait for a time when it's more easily available to more number of people. For a country as large as ours, we do need lots of them. Remember, and you need 2 doses of each of these vaccines to ensure they're effective on any person. Let me go across to our viewers. Dr. Shashi is calling us from Bhatinda and has a query for us. Good evening, Dr. Shashi.
Good evening to all the panelists. I'm a neurosurgeon and my query is, can you hear me?
Yes, I can. Go ahead, please.
Yeah, my query to all the panelists is that in case one is given a choice between the vaccines Covishield and Covaxine, which one would you prefer and why?
I don't think we are getting that choice for now until it's in the open market maybe.
Yeah.
But okay, let me put it out there if anybody wants to stick out their neck and answer this one.
I will tell you.
Yeah.
From whatever little research we have done, let me tell you why I'm answering this question in this particular way. Covishield is based on just the viral protein, the core protein of the virus, whereas the Covaxine is based on that entire protein. And when we are looking at the emergence of these two new variants, which have caused a lot of alarm, and India itself has now seen a large number of the variants appearing in the Indian population, chances of your getting protected with a Covaxine, the Bharat Biotech, is much higher than Covishield, which only looks at a particular area in the protein. So I think if I have to have a choice. The question is, right now we don't have a choice. If I have a choice, I'll go for Covaxine rather than Covishield.
Okay, to that then, Dr. Pujari, if you have a view, and many say, but as far as Covaxine is concerned, their trials are still a long way away from finishing and that data being submitted. So, should we even opt for that?
No, if you look at, if you are a purist, you would like to wait for a phase 3 trial and see efficacy results. But this is not a normal situation.
Right.
This is a pandemic situation, and there is kind of an emergency situation, and we need to have as many resources in our hand as possible. As far as the inactivated Bharat Biotech vaccine is concerned, we should remember that inactivated platform is one of the oldest platforms for vaccine development, and this has been across many infectious diseases been found to be an extremely safe platform. The second aspect is also that inactivated vaccine is also being developed in China, and the publications are already there. They have been published in reputed journals for phase 1 and phase 2 studies where they have shown consistently good immunogenicity. As well as India, the data is available in preprint format from the ICMR biotech. So as far as safety is concerned, there is no issue. As far as immunogenicity is concerned, it not only induces antibodies, there is data that it induces T-cell response as well. So I think considering weighing all these factors in an emergency situation, I think particularly it being a tested platform for safety, we should not be hesitant in trying to choose between these two. Whatever is available is something which you should really go for.
Okay, thank you for that.
One more thing to add here is,
yes.
Unlike the Covaxine, all of the two platforms which are being today in the market, they are all based on adenovirus-based delivery system.
Okay.
Till today, correct me if I'm wrong, there is not even a single adenovirus-based delivery system vaccine in the market till today. So COVID is the first adenovirus-based vaccine being tried at the large scale. So, there is a degree of I would say question mark at the end of the day.
But, there is a general issue here I would like to mention. See, what is ultimately the objective? Why is this vaccination program starts? There are basically two objectives. One is to reduce mortality and severe illness. That is one thing. That is important because we can't afford to lose people. We have lost 140,000 people in a span of 8 months. We can't be losing people. So the fundamental issue here is how to prevent deaths and how to prevent severe illnesses, which cost money. Second is breaking the chain of transmission so that one doesn't pass on to the other. These are the two public health objectives of any vaccination program. And in both the cases, both the vaccines, those purposes will definitely be served. So let's not look at this or that. Both are going to do the twin purposes of reducing the morbidity, reducing the mortality, and also breaking the chain of transmission.
Dr. Gangar Khetkar, you're the only one left now to share your view on this one. Which vaccine?
No, just one thing which I would say. Now, please remember today, when the infection is on decline in the first wave, you are thinking which vaccine to choose. No, just imagine what's happening in UK. Just imagine what is happening in USA.
Yes.
Just look at Japan, which is facing the worst cases today. Suddenly you start finding that the hospital beds tend to be not available for those who actually need it. So if you look at it, from that point of view, the choice doesn't exist just because no, we are perhaps experiencing less number of cases as of now.
Correct.
So the risk perception has gone down. But you must remember that if you look at those countries, you will find that the second or third wave, when it comes at such a dramatic speed. The cases increase dramatically, and then we have nothing to do. That's one thing which I would say. Second thing which I would say, no, whether it is, let's say, like Dr. Hasnain did say, that adenovirus-based vaccines have not been tried. No, but today, the pandemic situation is forcing us to reflect on whatever experiences are coming from different phases of vaccine administration elsewhere in the world. Today, AstraZeneca vaccine is being provided in UK. Now, do I need to worry more about it? No, as long as serious side effects are considered, those numbers continue to be lower. Systemic reactions, they tend to occur in almost 50% of the patients, participants, which tends to get, it's a temporary kind of thing, which Mr. Prasad Rao already alluded to, that you would have fatigue, fever, and those kinds of symptoms, which will go after a few days' time,
Right.
which are easily treatable. So there is not much to choose in terms of side effects as of now. But at the same time, if you look at efficacy, all the reports that have come are beyond 90%. Please remember,
95%.
there is very little to choose between 92 and 94% when it comes to providing it in real life situations, because all those efficacy levels will go down to, let's say, around 80%, because this is real life effectiveness. So I wouldn't ever say which vaccine. I think getting the vaccine the quickest, if you believe the transmission dynamics of COVID-19 outbreak that you are witnessing in rest of the countries, and the vulnerability which continues to exist even in India, should be one argument which should make you think that what I am getting is something which would perhaps make me less vulnerable, and I need to take the vaccine and follow both the COVID appropriate behavior as well.
Okay, fair enough. And also, I don't think we have the choice yet. Maybe, like the government pointed out today in the health briefing, there are 3 and 4 other candidates which are currently under trial that the government is also keenly looking at, whether it's the Zydus Cadila or Biological E or even the Sputnik one, where trials are going on. And by the time all of these make it to the open market, we would have more choice. But at the end of it, what we need is protection from coronavirus, whichever way. And all of these vaccines at the end of it do have similar efficacy levels. Now, let me go across to a few of our other callers on the phone line. I'm going to take 2 of them quickly. They've been patiently waiting on the phone for a while. Mohammed Ali from Farooqabad on the phone line. Good evening. Go ahead, please.
Hello. Good evening, Tanvi ji. Very good evening to all of you. Hello.
Yes, go ahead, Mohammed.
Okay, so my question is basically, I've got 2 questions. My first question is that it is an hypothetical situation, and it is an mRNA-based vaccine. Especially, I'm asking to Dr. Ganga Khetkar ji, because he is an epidemiologist here, and all of them can answer this hypothetical question. But suppose the vaccination programs is for the frontline workers, and then later on to some other people, but still we know that this is a voluntarily based vaccination program. So suppose if 30 to 40% vaccination is done, and we are looking out at a herd later on, we are looking out for a herd immunity process, the way it will go. And suppose some people from other parts of the world come on with other strain of virus, does this herd immunity process will be affected by this? And my second question is about the administration of the vaccination program. Suppose if the right people are not getting the vaccination, is there any any mechanism by the government to take a note of the people that only the right people in the right phase are getting the vaccination? There is no mislead, or there is no loopholes so that we don't mislead from our phase-wise vaccination program.
Okay, Dr. Ganga Khetkar, the first question to you about, does this impact our herd immunity hopes?
Yeah, please remember, herd immunity is a concept which includes not only people who have acquired it through natural infection, but also those who have acquired it from vaccine program. Now, with the new variants that are coming in, the entire threshold is now considered little differently. Initially, the range used to be anywhere between 60 to 74% by different modeling studies that it would be good enough to eliminate this particular infection. However, with the variant strains coming, now people are worried because you need to have a higher threshold for herd immunity. That is also something which is very difficult to achieve given the entire population size that we have. So taking vaccine is a critical step so far as we understand. If the variants tend to come, and let's assume there would be a day when that variant would require a different vaccine, like we take for influenza some other vaccine, maybe after 1.5 or 2 years time, if we are required to take another vaccine that covers us for variant, it really doesn't matter. But I would strongly believe that please don't confuse herd immunity as one which is only because of natural infection. Vaccines is one important mode, and rapid scale up is essentially required, and that's the reason why you find in UK they are talking in terms of giving one dose to as many as possible, because whatever small protection that it would offer, they want to provide rapidly the so-called in quotes herd immunity so that they don't develop this infection and provide the vaccine subsequently. So herd immunity will be impacted by both the rate of coverage as well as new variants that are likely to emerge. But then those issues come up only if we take vaccines additionally.
Okay. I think the other aspect of what Mohammed was asking, Mr. Rao, maybe you can come in here. Government's role in ensuring that, there are no middlemen who take away your vaccine.
Yeah. You see, one thing we should realize that this is one of the largest vaccination programs going through the use of digital technology. For the first time, we are using digital technology on a very large scale. Government has produced an app. You have to register on the app, and that registration requires a certain amount of pre-qualifications. Either you should be an employee, you have to produce some proof that you are an employee, or for those who are old, your other proof of age will be there. So unless you register in the CoWIN, the app, you are not going to be considered for vaccination. So there's no question of somebody coming through the black market or through the middleman and coming and getting vaccinated. You need to get that registration, which is done on the basis of certain documentation. So I think the misuse, to my mind, is very, 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 very little. I don't think there is any scope for misuse. And this use of digital technology for the first time we are doing in a health promotion scheme, health prevention scheme. Earlier we used to do it in medical care, etc. So this is a great step forward, I would say.
Yes, absolutely. In fact, CoWIN is going to be that platform which the government will open it up as an app to everybody when they have to get vaccinated. You will have to register yourself, submit your documents, and then the government will also end up tracking your response to the vaccine, dose 1, when you need to take dose 2. All of this will happen digitally. So that's, we're essentially hoping that really cuts out all the other problems of systemic issues, leakages, or middlemen stepping in, or even errors for that matter. We're hoping that also reduces error and wastage. Narsimhan, patiently waiting on the phone line, calling us from Bengaluru. Good evening, Mr. Narsimhan. Go ahead, please.
Good evening, Tanvi ji. And hello.
Yes, go ahead, please.
Yeah. I have a question to the panelist. This is a slightly different question today. And it is regarding in case of the patients who are suffering from autoimmune diseases like demyelination, etc., as it is, their immunity level will be reduced by that particular treatment. The treatment they give at least like twice in a year, like that. And then basically they're going to reduce the effect of demyelination, especially in motor nerves. So in that case, what is the risk profile for them to take this vaccine? Because immunity level in them is already reduced to some extent. They'll be prone to other infections already. And by this, does it have any type of a side effect which is not found in other people? I want your answer, sir. Kindly provide me the answer.
Thank you, Mr. Narasimhan. Any of our panelists who want to take this? Dr. Pujari, yes.
So we should understand that at present, the trials which have been conducted for COVID-19 patients, for COVID-19 vaccines have excluded population like the immunocompromised host, like cancer patients or chemotherapy or HIV. Now, the issue here is two things. What is the efficacy? What is the safety? Now, if in terms of safety, I think it should not be much of a problem, particularly because the platforms that we are using are not live attenuated. So immunocompromised hosts, they have a problem about, getting live attenuated vaccines where the virus can get reactivated. So in terms of safety, we may not have much larger problem, but of course, data is still awaited there. In terms of efficacy, I think the UK health department has actually said that you can take the vaccines even if you are immunocompromised, except that if you are severely immunocompromised, like you're having intensive leukemia and 2 or 3 other conditions. So I think you have to again weigh the risk benefit ratio. We know many of the immunocompromised conditions have a higher risk of severe COVID-19, and from that perspective it is a case to case basis situation. And from my as we wait for more data, I think we have to weigh this risk benefit ratio and decide whether we want to take the vaccine or not. But mostly I think the only problem with immunocompromised host is that when you give a vaccine, whether you can build an adequate immune response against the vaccine, which will protect you against COVID-19. Again, that is something which we really don't have much data for right now, but should be okay to take.
In fact, Dr. Ganga Khetkar, as you take up this question, we also had another viewer who wanted to know that viewer is also undergoing chemotherapy. Similar query that whether vaccine will be safe for such a patient.
I would look at it in two different ways. No, I will answer it in two different ways. For the first one, no, as Dr. Pujari said, we don't have any data.
Yeah.
But at the same time, you also need to look at what disease condition do I have. No, because there are conditions like motor neuron disease. I don't know what exactly he has. But then at the same time, we must also consider one fact that if I get COVID, COVID is also known to produce autoantibodies. No, these autoantibodies are getting generated, and therefore there is a fear that autoimmune diseases could be one issue which we may have to tackle, though that data is also not clear. So the choice depends on which risk do we take, whether the small risk that is associated with taking vaccine and any disease progression which has not yet been proven anywhere. No, it is not that those who have autoimmune diseases, we tend to say that please don't take any vaccine, because this is a general side effect of vaccines, and therefore I would not much worry at this juncture, but I must put a cautionary note that we don't have robust data with respect to this particular vaccine. And the second one, you talked of people who have malignancies. It is essential for us to understand that this decision should be taken on case-to-case basis in consultation with your oncologist, because he will have to weigh when did you receive your chemotherapy, because chemotherapy can bring in transient immunosuppression. You want a stronger immune response to the vaccine that is being provided. So that decision should be taken in coordination with oncologists.
Right.
Normally, it takes about 2 weeks to 12 weeks, depending on the level of immunosuppression and the reasons of immunosuppression, to wait for taking the vaccine. But it's a call which oncologists will have to take.
Okay, so refer to your own oncologist, basis your own case. They will be able to guide you better. Not enough data available there. I am completely out of time, and it's been a pleasure to have all of you panelists here, answering our queries, helping us understand better. Many more queries still left. But I do promise you the next 4 days we will attempt to do a lot more of these conversations and answer as many questions as possible. Vineet wanted to know, can these vaccines protect us from the UK strain? Most experts say, Vineet, yes, they will be able to. There is no data to suggest they don't. There's also no specific data right now to suggest that they do, because these strains are also new. But since the basis is the same, most experts say that it will help us with these other evolved strains as well. And of course, there was a question about how important is testing and tracing now that the vaccine is here. as important as it was earlier. What will also be extremely important is to track those who are getting the vaccines, how they are responding when they need to come back for their second dose. And after that, 14 days later, 1 month later, 6 months later, even a year later, remember, we don't still know for how long will this vaccine protect you. Will any of these vaccines protect you? We don't know that yet, because the research has been less than a year for all of these. So that's the time period. So we don't know if beyond that it will actually protect us. So for that, we will have to also track and constantly keep under observation those people who've got the vaccine done and how they're responding to it. Completely out of time. Thank you so much for joining us.